Good afternoon, everybody. My name is Amanda Reed, and I am a current student with Santa Fe College's Health Service Administrative Program. Not only do I have a healthcare background, but I also grew up and am raising children in a rural community. Where we can see here that rural communities make up a large portion of the United States. It was reported in 2020 by the Center of Health Statistics that about 14% of the population, equaling to about 46 million Americans, live in rural communities. Populations living in rural communities usually have several contributing factors that negatively impact their health. A key note to take away from this is that pretty much all of these can be solved with proper funding. Most rural communities are economically deficient and many patients lack healthcare coverage. The numbers really are staggering. It was reported by the Health Resource and Service Administration that about 65% of rural areas had a shortage of primary care physicians. My recommendation is going to be to increase funding, extend current larger urban care facilities into surrounding rural communities, and offer incentives and training to ensure adequate trained staff are retained long term. Our solution will be using the Shewhart cycle of improvement model. This cycle includes the steps of plan, do, check, and act. We can read more about this in chapter 11 of our textbook. We're going to be looking specifically at the plan and do portion for our plan today. It is safe to conclude that if we can get trained healthcare professionals from rural communities, implement the Troy medical approach, and look for partnerships with larger organizations, that we can improve both the access and quality of care to the rural communities. In rural Alaska, Dr. Kara Hart founded Troy Medical to help the rural community that she was serving. Many patients in rural areas face hours of travel time, long appointment wait times, and a lack of access to specialty doctors. Troy Medical integrates traditional health and cutting edge technology. A medical assistant in a micro clinic or smaller location helps pair the patient with the physician via telehealth. This blend ensures long-term, consistent care for the patient while helping to navigate the labyrinth of technology, internet connectivity, and medical procedures. Partnering with larger health organizations from urban areas will increase both access and quality of care, as well as if larger organizations found these microclinics in rural communities. They employ locals to work in those clinics and they use the Troy medical approach. It will bridge a major gap in care. Larger organizations can eat the overhead cost smaller practices would be unable to. Microclinics would also need a smaller number of staff to run, and physicians would be able to care for a range of microclinics continuously from their urban practices. With the help of the Department of Health, we will be able to partner with larger organizations to help bring quality care to rural communities. I propose that we offer resources and funding to established health organizations to allow for the creation of the microclinics, as well as training for local residents of those rural communities and the development of a telemedicine design. Offering grants for the formation of clinics, technology, and training would definitely be a way to start that. Offering loan forgiveness and scholarship funds for local students would help get them involved, as well as recruit them long term. Another great option for the microclinics is to create a microclinic affiliated with larger organizations. The physicians will be able to care for multiple clinics while also living in urban areas and making the pay that they feel that they deserve. By providing funding and establishing partnerships with large healthcare organizations, we can increase access to care as well as the quality of that care. A single physician providing care to multiple clinics will ensure long-term care to multiple communities. Training professionals from rural areas will help ensure adequate staffing that is well-trained and committed to their community. And microclinics help ensure that clinics are affordable, well-staffed, and a qualified physician is able to meet the needs of the community. Does everybody have any questions?